How are you now? Occasional talking head for smallcaps.com.au, James Whelan, joined here with a very special Sydney sunny morning, and your time here, I hope, has been amazing. Dawn Bitz, CEO of Adherium, healthcare company. I would love to explain to you what it is that they do. Usually with mining companies, it's actually pretty easy. You just go, they've got a hole in the ground and it's filled with X, and this is what they do, and they dig it out. With healthcare companies, it's a little bit different, especially when it comes to actual products and apps. Now, Dawn, thank you for joining us. And I hope, like I said, we'll talk in a moment about your time in Sydney. What have you got for us? What do you do?
Yes. Well, James, thank you for having me. And so what we do is we're a respiratory digital health company. And just to give you a bit of context about people who are suffering from respiratory diseases, it's a large number of patients. These are your friends, your family members who maybe have asthma, maybe a severe form of asthma, or they might have something like emphysema or a smoker's cough. So they're maybe your older friend, your older parent who's actually having to live on oxygen. And as those disease progresses, they can actually become worse and worse. That can send you to hospital. The problem with those diseases is that it costs the healthcare system tremendous amounts of money. Those can be prevented by really just appropriate medication use. But human nature, we tend to struggle with our medication use.
We're coming up onto the meaning of the name of the company. And this is where it all starts to make a bit more sense.
It all starts to make sense. So again, if your viewers can, I think they probably have seen these kinds of medications before. Pharmaceutical companies make these medications. They work very, very well. The problem is, as I mentioned it just a few minutes ago, is human nature to get a little bit less compliant in using our medications.
Tell me about it.
And so they don't work very well. So when you don't use them, the problem is only about 20% of the time, most patients use their medications correctly. So what Adherium has done, and Adherium's been around for quite a while, is they've created a jacket. That jacket fits onto the medication. And as you can see, we have different shapes and different sizes. These are smart jackets. They have sensors in them. And so as the patient actually uses the medication, when they use it, the sensors actually record a tremendous amount of information. That information is really important because we can trend that over time. We can look longitudinally over a period of time. We can see if the patients are getting worse, if they're staying the same, if they're getting better. And that is extremely important information to the healthcare system. And adherence actually drives reductions of costs as well as hospitalizations.
More adherence, less hospitalizations, better for the patient.
Less cost.
All right. And we're actually going to talk about how you make money based on that, which is always the most important thing. Stock code is ADR as well. If you would like a more confusing stock code, I think you could have picked one out as well, but it's all right. So it's not an ADR. The stock code is ADR. So there's that. Dawn, you've been on the road. Yeah. We had an amazing lunch with brokers yesterday.
We did.
That went very well. Some incredible questions. Some people very keen on the story. Yeah. What's been your main takeaway from your time in Australia?
Oh, well, first of all, I get to be in beautiful Australia.
Picked a great day for it as well, just to leave.
Melbourne. It has been phenomenal. Looking to get to Perth. So anybody who wants me to come to Perth, just call me. It's one of the areas I haven't had a chance to visit.
Most isolated city in the world.
I know, but it's such an important city especially for your mining folks, for sure.
Yeah, they love it over there. It's great. Yeah. I'm there next week, so I'm looking forward to it. Yeah.
Okay, perfect. But no, Sydney is a great place. People are wonderful, and I think in so many ways have been such an instrumental support system for this company. This is an Australian company, born and bred here on the Australian continent, and so I think it's very important for us to continue to have these conversations with the investors. I think I've met with over 50 investors over the last, week and a half or so.
You certainly have ticked the box of CEO that knows what they're talking about and also can sell and present it quite well as well. And that's just in my time with you as well. But it's too early in the morning for that sort of stuff. Now, we've got 5 questions. So we're going to go to 5 power questions. Here we go. Take a deep breath. We're set. Dawn, your eye care study shows a 235% improvement in adherence versus norms and an average adherence of 67%. With nearly 1/3 of patients above the critical 80% threshold. Why is that critical? But we'll get into that. What does this mean for real-world reductions in hospitalizations and cost for payers?
Yeah, so let me give you the context as to why or where we actually got those data sets. So basically, Adherium has partnered with a very prestigious and important hospital system in the United States called Intermountain Health. For those of you in Australia, that might not be a hospital system you're familiar with, but it's the same level and prestige of hospital system like the Mayo Clinic. And so that collaboration, the Intermountain Health System wanted to do a quality improvement study, and they wanted to do it as a real world study, meaning an all-comer study. So basically, didn't matter how severe your disease was or how less severe your disease was, everybody was welcome to come into this study because they really wanted to get a sense of true impact of adherence, as well as the ability to truly measure adherence. And so we reported this back, I think it was in September of last calendar year, the interim results of that study. So at that point, there was about 850 patients actually enrolled in that study at that point in time. And again, for context purposes, that's the largest real-world study that's ever been conducted on adherence at that point in time, and they're continuing to enroll in that study. But as a comparison, most adherence studies could be anywhere from 20 to 30 patients, and the biggest studies are 100 patients. So now that gives you a sense of the economies of scale that we're talking about that was generating the data that you just reported out on. So I think the key takeaways are that when you reach about a 60% threshold of adherence, that's been tied in the literature to about a 50% reduction in costs as well as hospitalizations. Is that data set contains the values and the information on reduction of costs, hospitalizations, readmission rates, emergency departments. So it's very data rich. It's literally like you're sitting on a rare earth elements mine.
Take you back to what we know about.
Yes. Back to the mining of data, right, within the respiratory ecosystem. So the exciting thing is that Intermountain Health, they've actually assembled that data into something called an abstract. They have submitted that abstract to one of the biggest, most important respiratory meetings in the entire world called the American Thoracic Society. That abstract has actually been accepted. That's very important and very, very meaningful, and will be presented in the meeting in May. And we'll see some early release of that data electronically in the April timeframe. So I can't tell you what right now the reduction of hospitalization costs and those really key parameters are, even though it's been accepted, because it's going to come public here in really a few weeks.
Okay. So, and not to guess it, but you can assume that based on the data, more data, better results.
And you can assume just by the nature of the acceptance by the American Thoracic Society that the data is very compelling.
All right. So a nice little teaser for everyone out there to paying attention. So May is that with little releases coming out.
May is that about mid-May, and maybe even seeing it electronically early April. And of course, as soon as it's available electronically, you'll see a release from Adherium on it.
Okay, we'll look forward to that one. So now, second question. Adherium, you've got access to more than 1 million patients, respiratory patients, through partnerships and 60,000 insurance verified RPM patients. First off, what does RPM mean? We'll get to that. What's the key driver that converts these verified patients into active recurring RPM revenue?
Yeah, so let me just kind of, again, give a bit of context. So with our focus on what's called remote patient monitoring,
RPM.
So that's RPM, remote patient monitoring, that is today our monetization vehicle that generates our recurring revenue that we've been able to report out on. And basically what that means is we've done a very good job in securing contracts with different medical clinics in the United States. One of them is a consortium of medical clinics called Allergy Partners. Through that relationship, when we actually bring on one of their clinics, we get access to all of their patients. And so we take those patients, we make sure that they have insurance, and then we actually put them internally into our commercial infrastructure. That means that we actually would call you. We'd talk to you. We'd tell you about our RPM program. We'd actually get you one of the devices that actually matches up with the medication that you're taking. And every single activated patient, that is worth about $55 per patient per month to Adherium.
So that's a recurring model.
And that's the recurring model.
I do like recurring revenue.
We do like
better than lumpy. It's a lot easier to invest in a company. Just on my side of things, it's a lot easier to invest.
Very predictable.
Yes,
very more predictable.
There's some charts that'll blow your mind. We'll see if we can get them slotted in here on the way through. Okay.
And so on the 60,000. So we actually have literally 60,000 patients in our funnel. In our commercial funnel that have been insurance verified, that we're now ticking through our internal processes to get those patients actually engaged and onto our program. And then, of course, for us to value them at $55. And that's by the US dollars per patient per month.
Yeah, for now, the reserve currency of the world. We'll see how we go. It's still early in the day. You're targeting 10,000 RPM patients by the end of 2026, which is up from 4,600. So it's almost over doubling the total patients as at December. You had 4,600 as at December 2025. Yeah. You're looking to get that up to 10,000 by the end of this year. What are the most important operational steps needed to hit those milestones?
And just a little bit of context. So we're actually targeting 10,000 RPM patients. The 4,000 was actually a total patient number.
Oh, okay.
So just to give a little context, we actually our target for 2025 was 2,000 RPM patients of the 4,000 patients. So we're going from 2,000 to 10,000 patients is our target for 2025. 2026.
So it's a five times mathematical.
5 times mathematical. But again, our
Still pretty early in the day.
Our trajectory is continuing to be driven towards that point. That really means for us is that we've got to continue to reinvest in the business, continue to build out the infrastructure within our call centers and our care team. Those are the mechanisms of how we actually generate the growth. We've got to continue to be efficient in pulling those 60,000 patients through our funnel and actually getting them to use our devices and to be a part of this overall program. And what that means is that we continue to build recurring revenue underneath this remote patient monitoring model. That continues to strengthen the organization, continues to build credibility with our investor base, and ultimately sets us up for something called value-based care contracts, which really are the next big leap, very lucrative opportunity for the company.
Well, that's where the next question and question 4, we're winding it up now. So the strategy that you have is for RPM, as again, $55 US a month per patient in a fee-for-service model. What are the plans to evolve that business into a more lucrative value-based care?
Yes, right. So I have said that 2025 for us has really been our transition year, right? We did some rebuilding of the organization. We've done top grading of the team. We've reallocated resources so that we're much more commercially focused. We've really been more focused directly on the U.S. market because of the reimbursement and everything that we've just talked about. With the data set that we're generating with Intermountain Health, with the infrastructure that we've built, the next big opportunity is to go straight to the U.S. insurers. And under those U.S. insurers, we can actually get larger contracts because, again, they have a lot of risk, they have a lot of costs. So when we can demonstrate we can reduce those costs, that gets them very excited.
Insurers want less hospitalizations as well. They're paying it out. Once they've already got someone, I can see how that.
Right. It's all very much interrelated.
Back self-interest.
Right. So for us, 2026 is really our transformational year. We keep building the RPM business. We keep building the infrastructure. We keep delivering the scale of the patients in that model. Then we package that with this really robust data set that, again, will be public here in the May timeframe. That at that point in time, we have a compelling argument to take to these U.S. insurers, and those contracts could be worth millions to multi-millions worth of U.S. dollars. And that for us is the end of 2026, couple of small contracts, building into much larger contracts in 2027 and 2028.
I did like that in the presentation that we had yesterday. We had a beautiful lunch yesterday and went through the presentation with some brokers, not shooting for the moon.
Right.
Initially, getting it right, getting it done, starting small, and then growing into something that's actually more substantial. It's a very smart way of going. It's not over-promising and under-delivering. It's probably underdoing it just quietly between you and me.
Well, let's just keep delivering.
That's right.
The first thing is let's just keep delivering.
That's right. Now let's talk about revenue growth because what we've gone over is amazing, and I hate to be blunt, but it means nothing unless you can grow that top line.
Right.
What's the plan for that?
Right. Well, so I think what we've demonstrated over the last 6 months. So I arrived here at Adherium end of July. And so I think we've really built the foundations for, again, an amazing growth story. Mm-hmm. So if you look at our most recent 4C, we've been able to continue to build and build those recurring revenue months, about 20% month over month in revenue growth at the top line. We continue to do that. That puts us on a trajectory to get north of $500,000 Aus dollars a month as we get in towards the end of this calendar year. That then puts us onto a trajectory, especially with these value-based care contracts, where we could be getting into, 8 figures of revenue within the next, 18 months or so.
And it's straight, predictable.
Recurring, and even more
doesn't depend on some critical mineral in the middle of nowhere having to be dug out
or even transactional sales, right? Transactional sales are good, but you got to fight for those transactional sales. And the glory here that we've, I think, established to be able to demonstrate really over the last 6 months is that the data and these programs are important, number one, and they're repeatable, and we're getting paid for them.
Well, thank you very much for joining us today for this one. Is there anything else? Your time in Australia just been amazing, and when do we get you back?
It was amazing, and I'm hoping to be back in the May timeframe to be able to talk a bit more in detail about the data set that'll be out.
That's a very key driver, I think, of what's going to be happening there on that one. So thank you very much for joining us here,
James,
and we look forward to having you back here. Dawn Bitz, CEO of Adherium, stock code ADR. Check it out. Nice straight line revenue, and I'm pretty happy to be behind this one. Thank you.